Good afternoon, everyone. You are very welcome to the Irish Cancer Prevention Network Aging Well, How to Reduce Your Cancer Risk webinar in association with Age Action Ireland. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you are using an iPad, you will find this feature located at the top of your screen. Without further ado, I would now like to hand you over to your MC for the day, Consultant in Public Health Medicine in the National Cancer Control Programme, Dr. Trina McCarthy. Thank you.
Good afternoon, everybody, and a very warm welcome to our webinar today on behalf of the Irish Cancer Prevention Network. The aim of our network is to bring together organisations with the common aim of reducing cancer risk for the people of Ireland. This includes collaboration on cancer prevention initiatives in Ireland, agreeing consistent evidence-based cancer prevention public awareness messages, and disseminating up-to-date cancer prevention research. So today's webinar is a collaboration with Age Action Ireland, and we're delighted to be holding this during Positive Aging Week. For most people, increasing age is the strongest predictor of increased cancer risk. But research has shown us that over 40% of cancers are preventable. So there's a great opportunity to work on those modifiable risk factors and to see how we can empower our patients, clients, and communities to make changes which will reduce their cancer risk. And then we're also going to look today at how screening programs can help detect treatable precancerous conditions or detect cancer at an early stage, the importance of symptom awareness and acting early on signs of cancer, and also how we can support people to live well and beyond cancer. So I'm very much looking forward to hearing all of our speakers today. And if I could introduce our first speaker, will be Professor Román Romero-Ortuño. And Roman is Associate Professor in Medical Gerontology and Associate Director of Postgrad Teaching and Learning at Trinity College Dublin School of Medicine, and also a consultant physician in St. James's Hospital in Dublin. He also co-chairs the Frailty and Resilience Work Group of the Irish Longitudinal Study on Aging, or TILDA, which will be familiar to many of you, and the Irish Frailty Network Interest Group of the Irish Gerontological Society. And Roman is going to talk to us today on healthy lifestyle choices as we age. It's never too late. So over to you, Roman. Thanks.
Thank you very much. Very kind introduction. And I am delighted to be here with you all today, talking about healthy lifestyles as we age. And indeed, it's never too late to look into that. So I hope you're comfortable where you're listening and you can hear me and see me okay. And I'm very grateful to the Irish Cancer Prevention Network for having invited me to deliver this talk today. It's going to be a great day, very informative with all the colleagues around. We know it's no secret that life expectancy is increasing over time. It's one of the successes of modern times where we live for longer, but the actual message is that we need to live not only for longer, but with maximum possibly quality of life and with the maximum level of physical, emotional, psychological, and functional independence for as long as possible. It is true that if you look at life expectancy, in Ireland, we have an average life expectancy at birth of around 80 for males and 83 for females. But of course, that is at birth. If you are 65 or more, you should add 18 years of life expectancy for males and 21 for females. And if you are 75, you add 11 to males and 13 for females. Even if you are 85, you still expect to live 6 more years for males and 7 more years for females. And of course, there's been an increasing in the amount of years that we expect to live. One thing is the average life expectancy, but the other thing is the healthy life expectancy. So life expectancy that is lived with reasonably good quality of life and independence. So in Ireland, even though the life expectancy at age 65 would be adding about 18 more years in males and about 21 more years in females, the proportion of healthy life years could be about 61% for males and 57% for females. So luckily, there is more than a half of those years that are lived with reasonably good quality of life and in healthy state. Of course, as we get older and even as we are younger as well, sometimes even if we are robust, there are stressors that impact on our lives and on our bodies and our physiology. Cancer may be one of those stressors as well. The more robust you are when you are, before that stressor impacts on you, the more likely you are to recover, even if it's, been an important stressor. Of course, if you are a little bit frailer in older ages, and that means that your physiological systems are a little bit less agile to respond, the same stressor could cause a decompensation and be more likely to result to a point where you develop some dependency during and after that stressor, and the recovery may not be as quick as it would have been if you are in a state of robustness. Cancer diagnosis and treatment, as you all know, it is part of that stressor model. Of course, as cancers do occur more frequently in older ages on average, of course, the incidence of cancer leading to the diagnosis, but also the treatments that are necessary to cure and manage cancers in older age also provide stressors to the body. So much so that it's been said that cancer diagnosis and treatment in some instances can lead to some acceleration of the biological aging process. And that is an important concept because chronological age is how old we are, is our calendar birth, is one concept. But of course, biological age is how fit we are, regardless of how old we are. And of course, that is something that we could modify, acting upon preventative aspects, also realizing that biological age is modifiable to a good extent medically, but also socially and with preventative approaches. COVID has also posed a big stressor in the older sector. I do research in the Irish longitudinal study on aging, where we have studied over time the incidence of exhaustion symptoms, especially during the pandemic as well. So we are estimating that over 50% of Irish older people over the age of 50, and when 50 is not necessarily considered older, but about 15.6% have experienced new symptoms of exhaustion during the pandemic. We are running a Science Foundation Ireland study called the TROPIC study. We're trying to understand drivers of the fatigue around COVID, and these are similar aspects when you have to consider not only the biological but also the psychological, the social, and the ecological model around any illness. And this is the way we would like to consider cancer, not only a physical aspect but also an eco-bio-psychosocial aspect, where you have to provide a more holistic assessment. And there are a lot of avenues for intervention. So we could actually hope that symptoms and fatigue and that acceleration of biological age can be addressed by following a lot of simple things regarding lifestyle and also a little bit of a change in the mindset. We know in the area of COVID-related exhaustion, it is more significantly common in states where people report poor mental and emotional health. So we think that attention to emotional and mental aspects is extremely important in managing any stressors that occur over time, being COVID, being cancer. And that is something that really can be affected through social networks, through social support, through good information and signposting, through resources that are out there. The effect of family, friends, and loved ones, and a lot of creative stimulation can be very beneficial as well. We think obviously that the physical limitations, of course, are a very important part of this. But we are looking at fatigue symptoms being driven by a lot of psychological and emotional aspects as well. So we know in post-cancer fatigue, there could be a lot of modifiable factors when we look at emotion, mental aspects, and also quality of life. And one of my areas of interest is the area of the assessment and management of frailty in aging adults. And there are a significant proportion of very older adults that have history of cancer, although the minority, though, when you look at a population-based study. But one of the things and the messages that really want to emphasize today that really is very applicable to the cancer journey is that things come and go, that frailty state is not something fixed. So this slide shows you the 8 years of the longitudinal study of aging and how we utilize some measures of frailty in the whole sample. And this is called an alluvial path because every flow stream really shows changes in the frailty status of these participants. And of course, you can see that a lot of things do change. So even frailty states are not necessarily going to persist into the future. And people come in and out of frailty states quite frequently, actually. So yeah, it is true that there are non-favorable transitions as we get older. There is a 27% risk, for example, to get into a stage of pre-frailty from a non-frailty state, but actually is more frequently to come to a non-frail state from a pre-frail state. So improvements have been seen even more commonly than deteriorations. And of course, it is an important message for today to consider that around stressors and around life situations, for example, like a diagnosis and treatment of cancer, it is important to understand that at some point, perhaps there is a dip in well-being, in function, but there is a lot we could do to try to ameliorate that situation. And in many cases, it does return to a very good baseline. And within that context, there is quite a lot of research in general, aging research and gerontological research about what are the things that are important to try to reverse and delay this frailty, this exhaustion, these poor health states, and how we could really work together to maximize the number of years at any stage and under any circumstances where those life years that are added are in good health or as good health as possible. And we did a systematic review with colleagues in University College Dublin, looking at all the interventions that can be offered in primary care to try to delay and reverse frailty. And we actually assessed how effective they were according to effectiveness metrics, but also we were interested in how easy they were to implement for participants, for patients, for loved ones in the context of a primary care or community dwelling situation. And actually, when you summarize those signals, very interestingly, strength exercises, physical therapy, nutrition supplements, health education, some attention to psychological and psychosocial health, and attention, to the multidisciplinary aspects, the home environment, that social support actually does have a lot of effectiveness to reverse and improve frailty. Essentially, we know that from the TILDA study that almost a third of community dwelling older adults are not in a high level of physical activity. So would be classified as having a low level of physical activity. And at any stage, and no matter what happens and around cancer treatments, essentially look at the arterial stiffness, actually, it is related to how active we are. So how hard your arteries and your blood vessels are, and your markers of cardiovascular fitness, how you take your oxygen, how fit you are, it's greatly determined by physical activity. Of course, there are some studies looking at how physical activity could even prevent cancers from happening, but there is more evidence looking at how physical activity could be very effective at optimizing the body before stressors like chemotherapy, radiotherapy, or cancer treatments come into place, to really make sure that the body reserve is better than it would have been, to minimize side effects and to make sure that the recovery is as quick and as integral as possible. And we think that physical activity, exercise, and nutrition have very important roles to play in that process. And avoiding the sedentary time, it's an important activity, but also paying attention to psychological well-being. It's a very important aspect because the reduction in the levels of stress could be very beneficial around that crucial time, pre-diagnosis, around diagnosis, post-diagnosis. And of course, trying to support people, trying to get their mind stimulated with creative activities, even volunteering, participation, utilizing the social networks, family, friends, neighbors. So that has also been proven to really improve health states at any stage. And we have to be optimistic because the study, Tilda study, has proven that actually the peak of quality of life is actually occurring after the age of 50. And then it does decline on average, but there is a lot of people at very advanced chronological ages that still reporting good quality of life until very advanced ages. But on average, people are happier between 66 to 68 years than before, which is interesting. And of course, that the negative perceptions we may have around aging can become a self-fulfilling prophecy. So till the studies showed that those who were actually having a negative perception of their own aging were more likely to decline in their gait speed, for example, longitudinally 2 4 years into that study, independently of any other health or medical aspects. So just that psychological mindset was very important, predicting a good, healthy, objective, healthy trajectory. The Tilda study has published resources around how lifestyles can be implemented in any situation. A lot of this does apply to cancer patients, and recognizing that adults over the age of 70 are indeed the fabric of our communities, the great contributions, and of course, really the great contributions that not only occur, in particular times, but throughout the life course that have loads of societal benefits and impacts. So that we can do a lot more to improve physical and mental health by actually paying attention to early symptoms, early signs that may indicate cancer or other conditions, not only related to cancer, but perhaps in other domains like psychological health and other areas of well-being. And essentially pay attention to remediable risk factors like high blood pressure, irregular heartbeats, osteoporosis, higher cholesterol. So pay attention to the vascular health, because no matter what happens when a stressor like cancer comes in, if those risk factors are well controlled, the body is that extra bit more resilient to withstand the stressor of the cancer journey, and people can recover easier. So that preventative approach is very important. Diet, there is some advice on the Tilda website. My colleagues here are going to circulate some resources that you could read more in detail about, for example, in terms of the diet and how to really kind of maintain a healthy weight body mass index, avoid sedentary behaviors, have a good balanced diet, with attention to this common sense food pyramid that again, no matter what happens in our life course, when the body is optimized from a nutritional perspective, you're more likely to withstand stressors. Of course, be attentive to preventing cancer symptoms and consult your doctor and good for seek attention, even if it seems minor, including any lumps anywhere in the body, any changes in the mole, in the color, in the shape, whether are bleeding or itching, whether the skin color has changed, to a more yellow or kind of a gray color. So if there is any voice changes, persistent hoarseness, changing the bowel habit, any abnormal bleeding that is unexplained, something that you're worried in, unexplained weight loss. So the good news is that a lot of those symptoms will not turn out to be a cancer, but it is important that at any age, it's never too late to seek advice and assessment for any of those symptoms as soon as possible, and maintain a positive attitude with good engagement, good attention to engagement and relationships, counteract those perceptions of ageism that sometimes are actually hindering the quality of life of our older citizens, to avoid sedentary behaviors, maintain a balanced, healthy diet, adopt that approach that if you're not using it, you will lose it. And if you will lose it, then you will be less resilient to any stresses that may occur, and cancer will be a stressor. So at all levels, not only the physical level. So maintain purpose in life, engage creatively, pay attention, those hobbies, those activities, relaxation and engagement creative. There's more and more evidence in the research literature that that's going to be important as a factor for good physical health. And pay attention to these common risk factors like blood pressure, cholesterol, diabetes. So those are going to be the resilience factors that are going to be on your side if you've looked after them before. And pay prompt attention to any symptoms that you may be worried about. Don't leave it too long. Just report it. Just consult. Just make sure that you know that's brought to the attention of the GP and the health practitioner as soon as possible. Most of the times, it's going to be nothing to worry about. But please don't stay away because you might think it's nothing to worry about. Just report it. I would like to thank the organizers today, my colleague who is speaking. It's going to be a very good, interesting day. I also thank my research funders and specifically the Tilda study who is doing sterling work on health promotion and prevention for the Irish population. And Tilda study is funded by the Department of Health, Atlantic Philanthropies, Irish Life. And I also thank my colleagues from the Global Brain Health Institute and the Science Foundation Ireland Tropic and Frailmantic study. Thanks so much, and I hope you have a great day.
Thank you. Thank you, Roman. That was really an excellent presentation. I particularly liked your holistic approach to positive aging. I think was really refreshing, and thanks very much. We're going to move on now to Lynn Swinburne, who will be giving our next presentation. So Lynn has worked in health promotion for 18 years in various community-based and HSE roles, and now she's working as a senior health promotion officer with the National Screening Service. And her areas of work include improving our understanding of the national screening programs, addressing challenges in participation, and empowering communities to achieve the maximum benefits they can from screening, prevention, and early detection initiatives. So I'll pass you over to Lynn now. And
Great, thanks Trina, thanks very much. And thank you to the Irish Cancer Prevention Network for having me here today. We're delighted to have every opportunity that we can take to promote screening, show its place in the reduction of the burden of disease of cancer, and give people take-home messages about screening that they can share with their family and their friends. Just to start to really, I suppose, make sure that people understand what screening is and what it's not. So we just describe it as a sieve. It's a rough sorting process where we have to decide who probably has a condition and who probably does not. It's not a perfect science, and no screening test is ever 100% accurate, but it does help us indicate those who may need further follow-up. So it's important to realize that while it is a very important tool, and it's a really good one we have in our arsenal of tools against cancer, it's not a perfect tool. So what we're trying to do when we talk about the purpose of screening is to identify people who are in a healthy population. So that's really important that people understand that screening is not for people who have active symptoms. It's for people who are actively well, going about their day-to-day living with no symptoms, no concerns about their health, and we invite them into screening. And what we're trying to identify is people who may have a condition so that we can offer them early treatment or intervention. And that we are hoping that that population that are identified as needing additional intervention, that we might have better outcomes for some of those screened individuals when we do treat them early and offer them that early intervention. So it's really important that people understand that screening has benefits and limitations, okay? And it's about balancing up these two when you make your decision whether you are going to participate in screening or not. So we do know that screening, it's great for giving you an indication that you may have a condition before any symptoms develop. And that is really, really useful at a population-based level. We do know that if we pick you up as having a condition through the screening process, chances are we will be able to give you a wider range of treatments, and they may be less radical because we've caught you so early in that disease development. It's also true that treatment at an early stage may be curative, and it does give you more options for treatment. On the limitation side, it's important to understand that, as we have said over and over, no screening test is 100% accurate. So we will miss some conditions when we screen for them. So we will give that false reassurance to people. We will tell them that their screening test is negative, and unfortunately we've missed something that is there. And that's what's called a false negative. We also then give false positives. So that's where we tell people that we've picked something up in their screening test and there's nothing at all there to be concerned about. And on further investigations, we will see that there's nothing that we're concerned about. And we do know that screening tests cause people a lot of anxiety. So when a letter comes in from Cervical Check, we do know that people are worried about that and they're wondering what the outcome will be for them. We do know also that there can be some conditions that won't cause the person any harm, and that they may not never know that they've had that condition, only for that it was picked up during screening. And it's important that we have a discussion about the limitations and the benefits, and we weigh up where do we think in our personal information and in our personal understanding of screening, and we make an informed decision about our participation in the different screening programs. So these are the 4 national screening programs that we currently have available in Ireland. Today we're going to focus on breast check, on cervical check and bowel screen, but we do have a diabetic retina screen program for those with diabetes in our community. So it's important to say that these are national registers of national population-based screening programs. Nothing got to do with your GP, or nothing got to do with any other service that you may be participating in at the moment. So it's a national system that's set up with individual registers for each screening program. It's important to remember that if you register for one screening program, that does not register you for the other ones. So you must register individually for each screening program. We collate those databases predominantly from the GMS, from the Department of Social Protection, from private health insurers, and from people then self-registering online into our screening programs. So please, one of the messages that I would ask you to take from today is that you check the registers that you should be on. Make sure your details are up to date, make sure your name is correct and your address is current, and familiarize yourself with our free phone number. And you can do all of that online on our websites, and we're going to pop some of that into the chat there for you. The first screening program we'll have a look at today is breast check. So this is for people aged 50 to 69. And one of the great things about breast check is that we have been able to extend that age profile from 55, from 50 up to 65, and then up to 69 in the recent years. So that's been one of the really positive messages in terms of aging that I would give at the moment, is that those older cohort of women that we hadn't been able to screen, we are now delighted to be able to screen those women. It's a free service. And again, it's for asymptomatic, so no symptoms. So the person shouldn't have an active breast symptom when they come to breast check. We're offering free breast x-ray. So that's 2 pictures of each breast that we take, and we call the woman every 2 years. I am conscious that there's people probably on the call today who haven't heard from breast check in over 2 years due to the COVID pandemic. And we are about a year behind in screening people, but you will be called if you are due as soon as we can get to you. So you come in for your breast x-ray, you have it done with us in either one of our mobile units or in one of our buildings in Dublin, Galway or Cork. You're sent your result within 3 weeks. And then if necessary, you will be referred onto the further pathway of treatment into one of our host hospitals. But it's important to remember that we're looking for early signs of breast cancer. So it's a small breast cancer that probably the woman won't be able to feel that we're looking for when you come to breast check. So this is one of our mobile units, and people will have seen these in various locations around the country. We've 21 of these, and we've just received another one last week. So we've 22 in the country at the moment. And this is where we can do that outreach into the community, so you don't have to travel far for your mammogram. So like all of the other speakers today, we're really asking you to be symptom aware. So please remember the symptoms of breast cancer, and please practice breast examination as often as you can, and remember all of the elements about it. So we're looking at things in the armpit, any new lump or thickening in the armpit or any part of the breast, a change in the size or shape or feel of the breast, anything on the skin around the breast that just doesn't look normal to you, redness, rashing, dimpling or puckering, anything that wasn't there before, something that's new, it's persisting and it's unusual for you. If you fluid leaking from the nipple or any change in that position of the nipple from where it was before. So we would encourage you to be symptom aware and to check your breasts as often as you remember to do that. We're going to pop 2 videos into the chat for you. So one is Dr. Ciara Kelly, where she gives a breast examination and she reminds women about the importance of breast examination. And Dr. Liz O'Riordan, who's a breast surgeon in the UK, who's living with breast cancer. And again, she just gives you some really nice ideas about how to thoroughly check your breasts. Just moving on to cervical check then. This is a very, very big program that we operate in Ireland. We've about 1.3 million women that we deliver this service to every 3 or 5 years, depending on their age. So it's for all people between 25 and 65 that have a cervix. We've moved to free HPV cervical screening testing as of March 2020. So every 3 years, a person will come for screening if they're the age between 25 and 29. And then there's a change now where people aged 30 to 65 will come every 5 years. So we've extended that age to 65, and we've changed the recall to 5 years for most of the screening population now. You'll go in as normal to your registered GP or your practice nurse, or any GP or practice nurse that you're comfortable with in having your sample taken. You will have it done in the normal way that you had the old smear done, except for this time, your sample will look for HPV. So the HPV is the human papilloma virus. We're looking for that now when we take a sample from you. If we find the virus, we do another test on the same sample, which is looking at if that HPV is causing the cells on your cervix to change. And if the two of those tests are positive, we will send you to colposcopy for further examination of the cervix. If we find HPV in your sample, but it's not causing changes to the cells on your cervix, we will rescreen you in 12 months to see if that HPV has settled down. So some people might be interested in why we now offer HPV cervical screening, and we've replaced cytology, which was the old smear testing system. And we do know that from a health technology assessment done by HIQA in 2017, that they had recommended that we move to HPV primary screening. We do know that it has a better rate of prevention of cancers, it's more clinically effective, and we do know we reduce the number of smears or of screens that a woman will have over her lifetime, and we do know that fits better for women. We can also see that it's a better test. So for every 1,000 women screened, 20 will have precancerous changes on the cells of their cervix. With this new test, we pick up 18 of those 20 women. And with traditional cytology, we were only picking up 15 of those women. So we know we have better clinical outcomes with HPV primary screening. And we know we're moving in line with other countries, such as Australia, who have moved to HPV screening a number of years ago. 1 minute on HPV, so we just get a real understanding of what we're talking about. So it's linked to 92% of cervical cancers. The other 8% tend to be the lesser and rarer types of cervical cancers. So HPV has huge implications for cervical cancer. We do know that most people, once they become sexually active, do get cervical cancer, and they will never know that they have HPV unless there's an indication, possibly through their cervical screening. Most people will clear HPV within about 18 months, and their immune system will do that. So we're really concerned about the women who've got persistent long-term HPV infection, and only about 5 to 10% of the women that we screen will have that. And it's important to know that we're looking for, of the 100 subtypes, we're looking for 14 of those which are high risk for cervical cancer. So they're the ones that we're currently looking at when we do a HPV test on a woman. Again, really important, we screen you every 3 years or every 5 years. So in between those screening tests, you need to be symptom aware, and you need to check in with your GP if you're noticing any of these additional symptoms for you. So any bleeding outside of normal periods, bleeding during or after sex, or bleeding after the menopause is something that we want you to pay particular attention to. Any vaginal spotting or unusual discharge, pain during sex or bleeding after sex, or any pain in the pelvis that's new or unusual or persisting for you. Please just consider these symptoms and be aware of them and share them with your family and friends. And we really need people to hone in on these and try to spot them as early as they can into the GP for a gynae referral if you think you have any of these symptoms. The thing then is around this new screening program that we have since 2015, which is Bowel Screen, a really brilliant public health initiative that was brought in 2015. We have a very high death rate of bowel cancer to incidence rates, so we knew that we needed to do something to try and bring that incidence down and reduce the burden of bowel cancer mortality. So this program is offered for those between 60 and 69. That's the current screening age that we're working to. When we extend this program out, it will go from 55 to 74 years. But for the moment, we're operating between 60 and 69. It's a free test again every 2 years, done in your home this time. So it's a home testing kit, and the kit is sent out to your house. And you do it in the privacy of your own house. It is a stool sample that we're looking for. So you do the poo at home, you dip the stick in, you send it back to us, and we test it in the lab. We're looking for amounts of blood that are not visible to the human eye. So that's really, really important. We have a lot of people who say to us that they don't do the test because they can't see the blood. But we're actually looking for blood that you can't see. So you shouldn't be able to see that blood. We will then test that in the lab, and if we see that you have blood in your sample, we will send you on for colonoscopy to one of our endoscopy units. The results will come out to you and to your GP 4 weeks after you do the test. And again, if blood is found, we will take care of all of the referral pathway for you. So this is just the kit. I think it's really important that people have a visual on the kit just to see that it's not very big, it's not very complicated. You do a tiny sample, you do a tiny dip of the vial, and you pop it back into the envelope, and we take that back from you and test it in the lab. The symptoms of bowel cancer, again, be very aware of these. So any bleeding from the back passage, and bleeding that you can see this time. So any blood, again, in your poo that you can see. A change in your normal bowel habit that is persisting for 4 to 6 weeks. Any lump that is, any visible lump that you or your doctor can feel in your back passage or your tummy, or anything that a feeling that you need to strain when you're going to the toilet. Any losing weight that's unexplained, any pain in the abdomen or the back passage, or any tiredness or breathlessness that's caused by a lower level of iron in the blood. So any of these, we would ask you just to review them, think about them, and again, in between screening tests, be aware of them. So the public health impact of screening, I suppose I wanted to give you an example of one of the ways that we can help reduce the burden of cancer. So the last report that we did on bowel screening showed us that in 2016 and 17, that we had 197 cancers detected, and 60% of those cancers were at stage 1 and 2. And that's really important because we do know that bowel cancer is predominantly picked up in stage 2, 3, and 4. So we're helping to move that staging back to stage 1 and stage 2 when people have more treatment options and better treatment outcomes. The other thing to say is that we had 300 participants on the program who had advanced adenomas removed. And we know that if we leave these in situ, that they have a good chance of progressing into a serious cancer. So again, they can be considered as a preventative methodology there on bowel screening. To leave you with some positive aging messages just to celebrate the week. We would all encourage you, and I think everybody in the panel today is going to talk about, please be symptom aware. Know your body, know what's new, know what's unusual, and know what's persisting for you. Talk to your GP about your individual risk and your family history included in that. Screening is about population-based risk, but it's important that you have a discussion around your individual risk and you include your family history in that. Always think primary prevention. The more you can do to build that primary prevention foundation for you is a really good way for you to prevent chronic diseases and cancer and prevention. If you do have an issue or concern, please talk to your GP and know that those symptomatic referral pathways are there for you and they are available irrespective of what age you are. And even if you're the screening age and you have a symptom, please go the symptomatic way and talk to your GP about getting a referral onto one of those pathways. Participate in screening. If you feel that it is for you and you've got a good understanding of the limitations and the benefits, and we'd be happy to support that participation in any way we can if you need additional support. So I hope you've learned 1 or 2 things and some take-home messages that you can share with your family and friends today. And thanks to the Irish Cancer Prevention Network for letting us share that screening message today. And I really hope you enjoy the rest of the webinar.
Thank you, Lynn. And if people probably have seen in the chat function, hopefully there's been quite a few links shared there for further information. So we're just going to move on now to Dr. Una Kennedy, who's giving our next presentation. So I'll introduce my colleague Una, who's a GP working in Dublin and also a colleague of mine working as a GP advisor in the National Cancer Control Programme. So Una's very passionate about increasing cancer symptom awareness and improving the pathways to cancer diagnosis. And today she's going to speak to us on acting early on signs of cancer. So over to Una, thanks.
Thanks very much, Trina, and thanks to everyone for joining us here today. So I'm going to speak about cancer and aging and detecting cancer early. I think we all have an intuitive sense that cancer risk increases with age, and we're correct about that, and the data bears that out. Now, this graph, I apologize, it's a bit faint, but what it shows along the x-axis are the age brackets up to the age of 85 plus, and on the y-axis, the upright axis, we can see the number of cases of cancer per 100,000 people in each age group. And what it demonstrates quite nicely is that once you hit your late 40s or early 50s, your risk of cancer increases as you age. So it confirms what we all instinctively know, that as you age, your risk of cancer will increase. So knowing this and having this knowledge, what do we do? How do we act to ensure we find cancer early? How do we approach this? And I would suggest to you that we start by knowing what are the common cancers in Ireland. And this is what it looks like for women in Ireland. As you can see, about 1 in 3, 30% of female breast cancers in this country female cancers are breast cancers. And that's followed up with lung cancer, followed up by colorectal or bowel cancer, and followed up by melanoma. And together, those 4 cancers in women make up about 60%, just shy of 60% of all the cancers that occur in this country. If you move on to men, what you find is that the picture is very similar. You simply substitute the word prostate for breast, and you get an almost identical pattern. Almost 1 in 3 cancers in men are prostate cancers in Ireland, followed up by colorectal, followed up by lung, followed up by melanoma. And just like with women, those 4 cancers make up almost 60% of all the cancers that occur in men in this country. Now, why do we want to act early on the signs of cancer? Why do we want to detect it at an early stage? Will it make any difference to our outcome? And the answer to that is very much yes. Picking up cancer early makes a huge difference to your outcome, or can make a huge difference. When we talk about cancer, we talk about 4 stages very broadly. Stage 1 being early stage cancer and stage 4 being late stage cancer. We also talk about 5-year survival, and that's your chances of living for 5 years from your date of diagnosis. And you can see clearly here for those top 5 cancers, the commonest 5 cancers in this country, the difference between diagnosing at stage 1 and diagnosing stage 4 can be really huge. You look at melanoma and you can see that 99% of people diagnosed with stage 1 melanoma will live for 5 years, falls to 62% for stage 4. For bowel cancer, 95% of people diagnosed stage 1 will live for 5 years, and it collapses to 11% at stage 4. And I think in light of Lynn's presentation, if there was ever an argument to participate in bowel screening, that would be it. And even lung cancer, which has the poorest survival of those common cancers, the 5-year survival diagnosed stage 1 is 50%, and it's a very, very small 4% of people living to 5 years if they're diagnosed at stage 4. So it's really important that cancer is picked up early. And what do you have to do to pick up cancer early? Well, we need to know the signs and symptoms. We need to be vigilant for the signs and symptoms. And crucially, we need to be ready to act on the signs and symptoms of cancer. And that typically means picking up the phone and talking to a healthcare professional. For most people in Ireland, that means calling your GP. So I'm going to run through the signs and symptoms, the commonest signs and symptoms of those common 5 cancer very quickly. These are the things people should look out for. Starting with breast cancer. Like all cancers, yes, it is a disease of the older age group. 75% of cases or thereabouts happen in people over the age of 50. This slide is a bit busy, I'm afraid, but we divide the breast in our thinking into 4 groups: the breast itself, the breast and the underarm, nipple conditions, and then skin conditions in the breast. And in the breast, it's the breast lump that people are looking for. Moving on to the breast and underarm, you're looking for a breast abscess, a suspicious lump under the arm, asymmetric focal nodularity persisting beyond one menstrual cycle, and that just means lumpiness that doesn't go away, or an image detected abnormality. So if you've been somewhere and had a scan that shows an abnormality on the breast, that should be looked into. The nipple conditions would include one-sided blood-stained nipple discharge or a watery white serous discharge. If there's changes in the nipple in that it is fixed and doesn't move, or if it's retracted and pulled in on itself. If you have eczema or dry skin around the nipple that doesn't go away with treatment. Skin conditions then include the skin dimpling, or what we call the peau d'orange appearance to the skin. And if you imagine the skin of an orange, it is thickened and dimpled. And sometimes in breast cancers, the skin of the breast can become thickened and dimpled like that. We've already mentioned nipple eczema and breast abscess. Moving on to bowel cancer. Bowel cancer, again, it's commoner in people over the age of 50. 90%, 92% of all cases occur in people over the age of 50. And the median age of diagnosis is 65 to 69. Typical symptoms, although these are not exhaustive, would be bleeding from the back passage, rectal bleeding that would go on for 6 weeks or more, a change in your bowel habit that will go on for 6 weeks or more. If somebody tells you that you have a low blood count and you've low iron, so if you've low iron and you're anemic, that should be looked into. If you've unexplained weight loss that has happened without you trying or without you deliberately dieting. If you yourself feel a mass in the tummy, or if somebody examines you and feels a mass in your tummy, or if there's a rectal examination and they find a mass in the rectum. And finally, you should remember family history, which may be significant for bowel cancer. Lung cancer, which has one of the poorest survivals of the common cancers. Lung cancer is not our commonest cancer in this country. It's the second commonest women and it's the third commonest in men, but it is our biggest cancer killer. It kills more people than any other cancer in this country. And this really is a disease of old age. 97% of cases occur in people over the age of 50, and your median age of diagnosis is 70 to 74. So it does typically affect older people. It's a tricky cancer because the signs and symptoms of lung cancer can be vague and non-specific. So they're easy to miss and difficult to spot sometimes. So we created this at the NCCP, which you can find on the NCCP website. And what it does is it combines or tries to combine the person most likely at risk of lung cancer together with the commonest symptoms of lung cancer. So if you look at your right, you can see who's at risk. Well, men and women, it's not just a male disease, it's men and women, tend to be older, tend to be at least over the age of 50. It's strongly associated with smoke, so it's commoner in smokers, in people who are ex-smokers, or in people who are exposed to smoke. That would be the passive smokers. It's strongly associated with socioeconomic deprivation. And finally, lung cancer is also associated with radon. Radon is a naturally occurring gas. It exists in our environment. It's produced by soil and by stones. Some parts of Ireland have more radon than others. It is associated with a certain percentage of lung cancers in this country every year. And more information about that can be found on the Environmental Protection Agency website, epa.ie. So if you imagine that person and put them together with these symptoms of lung cancer, and the big symptom of lung cancer is a cough. 66% of new lung cancers present with a cough. Now, it could be a changing cough in someone who coughs all the time. If you imagine your smoker who has a smoker's cough and they say, this is not my usual cough, this is different, there's something different about this. Appetite loss or weight loss that is non-intentional. So if you haven't been trying to lose weight, you're not trying to diet, and yet the weight is falling off you. A new cough in somebody who has never coughed before, and a new cough that is persistent, by which it means it doesn't go away after, say, about 3 weeks. Chest or shoulder pain if you have a tumor that is pressing on a certain part of the chest or on the shoulder. If you're easily breathless, more than usual for you. So if you say, well, I could always walk down to the shop to get my groceries, or I could always make it up the stairs, but all of a sudden I can't, that's significant potentially. And if you're really tired, it's a vague sign. I mean, arguably everybody is tired all the time, but if you are way more tired than you would reasonably expect, that's worth checking out. Just going to mention hemoptysis, which is coughing up blood. It's one thing that pops up all the time when people talk about lung cancer. It's not a common presenting sign for lung cancer. It's not commonly the first thing people come in with. It only occurs in 20% of lung cancers ever, and it is the first symptom in about 5% of lung cancer. So it's not a common sign, and you can't wait for people to cough up blood. Prostate cancer, which is the commonest cancer in men in this country. Again, 97% of cases over the age of 50, and the median age of diagnosis is 65 to 69. So like the others, it's a disease of older age groups. The signs and symptoms of prostate cancer can be very easily mixed up with signs and symptoms of benign prostatic enlargement that occurs naturally throughout our life. So they are difficult to spot, but if you have these symptoms, it's worth just thinking about getting them checked out. Passing urine more often, getting up at night to pass urine when you never did before, difficulty passing urine, the feeling that you can't empty the bladder fully, a sense of urgency that you can't wait to pass urine, or blood in the urine or in the semen. And finally, skin cancer, melanoma. Skin cancer is a bit like breast cancer in terms of who it affects. About 3/4 of cases occur in people over the age of 50, but the median age of diagnosis is 60 to 64. And these are what you should be looking out for skin cancer. We talk about A, B, C, D, E. So it should be easy enough to remember. A stands for asymmetry of a mole, asymmetry in 2 axes. B is an irregular border. C for colour, that there's at least 2 different colours in the lesion. It's variegated. D for diameter more than 6 millimeters, or about 0.5 centimeter. And E is for evolution. If the lesion or the mole on your skin is changing or growing, if there are little moles popping up around it, if it's bleeding, that's something to look out for. And also watch out for what they call the ugly duckling mole. And that's a mole that is just different to all the other moles around it. Finally, it's just worth saying that human beings aren't robots. Those would be the typical signs for common cancers, but humans don't always behave the way that the textbooks say that they will or should behave. And the symptoms I described above are the typical symptoms of cancer, but not everybody will present with those symptoms. And some people will turn up with vague, unusual, or non-specific symptoms. There are some things that we should all watch out for that could be nothing, but could be something. And here they are. This again is on our website at the NCCP. So watch out for new lumps or bumps, particularly if they're growing and don't go away. If they're changing, expanding, little lumps popping up around them. Watch out for abnormal bleeding anywhere, coughing up blood, vomiting up blood, blood in the bowel motion, blood post-menopausal bleeding, bleeding after sex, blood in the urine, early bruising or bruising a lot and very easily. Watch out for moles that change or that are new. Watch out for weight loss. Weight loss is a hard sign. If you're not trying to lose weight particularly and suddenly you're losing weight, that's a hard sign. If you're constantly tired, way more tired than you would expect. If you have a cough or a change in your cough going on for more than 3 weeks. If you have a change in your bowel habit that is not going away or not settling down. And if you have ongoing heartburn or indigestion. These are things that everybody should watch out for and check as soon as they can. More than likely, they won't actually be cancer, but they should be checked out nonetheless. This is our website. If anybody wants to look up any further information about this, and all that remains to be said is thank you very much to Trina and to Anya for all her hard work organising this, to Helena and Jean for their hard work in keeping us on track this afternoon, and to everybody for joining in and listening. Thank you. Thanks, Trina.
Thanks, Una. That was a great whistle-stop tour. Lots of take-home messages there. And I'm going to introduce Dr. Mairead Cantwell, who's going to be our last speaker today. Mairead is a clinical exercise physiologist and lecturer in the Department of Sport and Health Sciences in Athlone Institute of Technology. And her PhD at DCU in 2019 was on oncology rehabilitation, and that was awarded the Irish Cancer Society's first PhD Researcher of the Year award. And her current research areas are focus on the role of exercise in the prevention, treatment and management of chronic diseases. So looking forward to hearing from you today, Mairead.
Thanks, Trina. I'm delighted to be here today as part of Positive Aging Week, and many thanks to the ICPN for the opportunity to contribute to today's webinar. So today I'll be chatting about the benefits of physical activity for health, particularly in the context of positive aging and life during and after cancer. We'll talk about how we define physical activity, how much physical activity we need to do to benefit our health, as well as some helpful resources and tips that can be accessed to support those who are interested in becoming more active to do so. But I wanted to start today by asking you a question. So what if I told you that a new drug has just come on the market and there's fantastic research to show that it can reduce your risk of diabetes by 40%, it can reduce your risk of cardiovascular disease by 35%, it can reduce your risk of falls by 30% and reduce your risk of joint and back pain by 25%. And not only all of those benefits, but it can also reduce the risk of certain cancers by up to 20%, while also improving your sleep, quality of life, and help support in the management of stress. And on top of that, what if I told you that it was for free? So you might say that that's impossible, no such thing exists, but it does. And this wonder drug is physical activity. And in this way, we can think of exercise as medicine. While we might take a tablet to lower our cholesterol or improve our blood pressure, exercise is a poly pill because it can produce a number of benefits all at the same time. And specifically in the context of cancer, we know that regular exercise can reduce the risk of 7 common types of cancer. And they're illustrated in this image here and include breast, colon, and esophageal cancer. We also know that exercise before, during, and after cancer can help to optimize physical functioning and quality of life. It can support the management of a number of treatment-related side effects, including fatigue and weight management, and improve mental well-being by reducing symptoms of anxiety and depression. But perhaps the greatest benefit of all is that we know research shows that regular physical activity can reduce the risk of cancer returning and improve survival compared to individuals who remain active. So the take-home message here is really that fitter people live longer. And so you might wonder, well, how can physical activity achieve these benefits? What's happening in our bodies to reduce the risk of cancer returning, for example? And while our understanding of many of these mechanisms is still emerging, we can look at some of the proposed mechanisms for how physical activity can reduce the risk of breast cancer, say for an example. So in our bodies, we have a system of glands that make hormones, and hormones control a number of different processes, including growth, development, and other chemical processes. And research suggests that for postmenopausal women, exercise may decrease hormones like estrogen and insulin, and that this may contribute to a reduced risk for breast cancer. Chronic inflammation is a key contributor to breast cancer development and progression, and research shows that exercise has an anti-inflammatory effect. So this anti-inflammatory effect may be caused by a reduction in the fat that surrounds our abdominal organs, among other mechanisms. And we also know that oxidative stress plays an important role in the progression of a number of cancers. This is where we see the overproduction of something known as reactive oxygen species. And these can damage our DNA and inactivate genes that aim to prevent tumor growth. And research suggests that adaptations to regular exercise may protect against these actions and therefore have a positive antioxidant protective effect. So when we're referring to physical activity, what do we mean by that term and how can we define it? Well, really, physical activity is an umbrella term. It encompasses all movement of our bodies. It can include active living, so that's the accumulation of incidental movement throughout our day, whether that's movement that we do as part of our jobs or just doing chores at home. Structured exercise is planned, structured, and purposeful, and done to improve or maintain our fitness and our strength. And sport involves physical exertion, but also incorporates a skill component. And we engage in physical activity of different intensities. So they can be classified as light, moderate, or vigorous intensity physical activity. Light intensity activity incorporates general movement throughout our day, whereas when we engage in moderate intensity activity, we see an increase in our heart rate, in our breathing rate, and we start to sweat. And the magnitude of that response is even greater when we engage in vigorous intensity activity. And intensity is important because we know that exercising at greater intensities gives us a better return on investment. And what I mean by that is that the impact on our health is greater when we exercise or engage in more moderate to vigorous intensity activity. But we also know that a dose response relationship exists between the impact of physical activity on our health. And that relationship is illustrated here. So if we look at person A, this is someone who engages in very little physical activity. If they can increase their levels of physical activity participation, even just somewhat, they will see a significant beneficial effect on their health and quality of life. And as you'll see in the diagram, those who engage in greater volumes of physical activity at higher intensities achieve more health benefits. But the magnitude of their return tapers off the more physically active someone is. So if we look at person C, who's highly physically active, they still achieve a greater health benefit, but the magnitude of that response is less so compared to person A. So how much physical activity is needed to benefit our health? And if we go back to our exercise as medicine analogy, if physical activity is the medicine, then what's the dose? And you can see the recommended physical activity guidelines summarized in this image here. So focusing on the green part of the image first. So it's recommended that where possible, we try to engage in at least 150 minutes of moderate intensity activity each week. And if we exercise at a vigorous intensity, that time can be halved. Examples of moderate intensity activities include brisk walking, cycling, and swimming. Moving to the center of the diagram now, so we know in addition to doing moderate or vigorous intensity activity, it's really important that we focus on exercises that aim to build our strength. So that includes like lifting weights or doing yoga, and we should aim to include these on at least 2 days a week where possible. Moving on then to the orange part of the diagram. So in addition to our aerobic and our resistant components that we've just discussed, it's really important that we minimize the amount of time that we spend being sedentary. And sedentary behavior refers to long periods of sitting, whether that's watching TV or sitting at a desk. So breaking those long periods up with movement of any form at any intensity can be beneficial. And particularly in the context of older adulthood, so moving to the blue part of the image now, it's really important that where we can, we include activities to improve our balance on at least 2 days each week. That includes activities like lawn bowls or Tai Chi or dancing. And if you're someone who has cancer or has had cancer in the past, the recommendations for physical activity still remain the same. So depending on your phase of treatment and other factors, trying to avoid inactivity, moving more and sitting less may be appropriate goals for you. And when you may be experiencing less side effects from your treatment and you feel ready to do so, working towards achieving the recommended physical activity guidelines is advised. And you might be thinking, that sounds like a lot of exercise. But remember person A, those who have the most to gain in terms of health are those who go from doing little to no activity to doing some. So remember, every single step counts. And research shows that lower amounts of physical activity than those recommended in the guidelines can still have a really important role to play in terms of managing many treatment-related side effects. So for example, exercising just 3 times a week for 30 minutes can reduce cancer-related fatigue, anxiety, and depression. And we know that to achieve the best possible benefits of exercise for our health, we should aim to be physically active every day where possible. So if you're someone who's interested in becoming more physically active, how can you get started? Or similarly, if you're a professional working in health, how can you best support your patients to become more physically active? So I've just pulled together a couple of top tips from the research for you today. So the first is that research shows that people who exercise with friends and family are more likely to stick with it in the long term. So make it social, get your family and friends involved and be active together, and that's going to benefit everybody's health. You're also more likely to stick with exercise if you choose an activity that you enjoy. So why not try a new type of exercise and see if that one's for you? try to incorporate more movement into your daily life. Sit less, take the stairs, get off the bus to stop earlier, walk to the shops instead of taking the car. Remember, every single step counts. Having a commitment to go somewhere to do exercise can help us to stick with physical activity in the long term. So link in with your local services, and I'm going to come back to this one in the next minute or two. Set a goal for physical activity. Consider keeping a physical activity diary. Again, we know that making a log of how much physical activity we do on a weekly basis is a really effective strategy to support us to stick with physical activity in the long term. So if you're interested in becoming more physically active, where can you go to get some information? Well, if you're someone who feels confident to get started on your own, or you're just looking for more information and resources, the Sport Ireland website is absolutely fantastic. It has everything from an older adult home exercise program to an app that you can download on your phone that can help you to track the amount of walking that you do, to a phone line that you can call for more information and support. And the link to this will be shared with you in the chat feature today. If you're someone who you think you would benefit from exercising in a group environment, definitely make sure to check in with your local sports partnership. So every single county has one, and I've just included some examples from Meath, Waterford and Mayo sports partnerships here. All of these local sports partnerships run brilliant programs for opportunities in physical activity and offer really great opportunities for you to get involved. So check out them today. And again, a link for how to access or get in touch with your local LSP will be shared in the chat feature. If you're someone who's living with a chronic disease and you feel you may benefit from medical support for exercise, again, there's lots of great community-based exercise programs that are running. Exwell Medical have a number of centres nationwide, as do Seal Blue. So why not get in touch with them today, and if you're interested in going along to join one of those programs. And again, the link to those services will be shared in the chat feature. But if there is one message that I could leave with you today, that would be that being physically active is one of the most important steps that people of all ages can take to improve their health and their well-being. So remember, some physical activity is better than none, and more is better than some. But ultimately, just move more in a way that you enjoy. Just some references from today's presentation, and thanks very much for your time. Great to be part of today's webinar, and look forward to seeing the questions in the Q&A section. Thank you.
Thanks so much for that, Mairead. And unfortunately, that's bringing us to the end of our session today. I'd just like to thank all of our speakers today for giving us their time and sharing some really interesting information. And thanks the participants for engaging with us and for sticking with us over your lunch break. Hopefully, we've managed to deal with a number of your queries in the Q&A. But what we'll also do is we'll keep a note of the types of queries that have come in and look at whether we can cover them in more depth in any future sessions or give additional information out through the Irish Cancer Prevention Network newsletter. So with that, I'll just bring the session to a close. Thank you all again and look forward to engaging with you again in the future. Take care.